Hey everybody, we are here at TriStar StoneCrest Medical Center in Smyrna. This is an awesome video, a fun one. We had to come down here and introduce you to Dr. Ryan Jones. He's kind of a big deal. You've been featured on Daily Mail UK. You've been interviewed by the BBC, Fox News. You were interviewed, right before the president of some big country, the going name? This guy's a big deal, and he's right here at TriStar in Smyrna. So
I made the unfortunate mistake of telling him about 14 days of fame that I can't claim anymore.
That is not 14 days. That is like infamous. That is, I mean, you're a big doctor here. That is wonderful, and I'm so glad you're here at TriStar, right here in Rutherford County. And you are, what's your official title again? I apologize.
A radiation oncologist.
Radiation oncologist. Okay. And so is that for like me and our viewers, people that may not know any better, what type of cancer is that? Aren't you just all the above? What type of doctors are there?
I think it gets most confused with radiologists, who are doctors that review the various forms of images, help other physicians decipher the results of images, give out reports, help us know if something's wrong. It used to be that we were called therapeutic radiologists until the late 80s, early 90s when it split off as a separate specialty. Now we're called radiation oncologists. We're dedicated to the treatment mostly of cancers. There are some non-cancerous things we do as well. Nowadays you hear that word cancer, right? It's hundreds of different diseases. They behave differently where they start, with the tissues around them, with the risk they might spread elsewhere. And there are three main types of cancer doctors. Cancer doctor, study of cancer, oncology, okay? So there are surgeons that cut out things, physically remove it. There are medical oncologists that give drugs in various form, IV or pill. And then there's us. We use energy in various forms, whether produced by a machine or sometimes in physical form, like some of the particles or elements you learned about at the end of the periodic table. Well, you can isolate these in physical form. They emit an energy. You can use it to hopefully destroy tumors. It ends up that a lot of cancer types are treated with radiation, but not all. Not like blood-borne cancers, some of them like leukemias. Unless we're, say, preparing for a stem cell transplant sometimes. It's complicated.
I'm curious. So basically you go in and shoot the cancer with radiation, but how do you make sure you're hitting you don't take out my liver or something like that? Is that a lot of math involved? Like, what do you do? How does that work?
Sure. So the field dates back to the mid-1890s, back to when they first discovered X-rays, and they were fascinated, taking a bunch of pictures of the hands primarily. They noticed, wow, I'm getting some reaction on my skin. It's causing inflammation. I wonder if I can treat cancers. So just a few months later, they started attempts at treating cancers. The technology was rudimentary. It was not a good balance of safe amount of energy specific to the area. They hurt people. As the machinery got better, early 1900s, they got better at positioning a patient. Then the machinery developed an ability to move. Then, because of the advancements in imaging specialty, they developed an ability to pair imaging with the machines. So now we can take an image of a patient on the machine, line you up just right. The machines are beautifully complicated over the way they move. What used to be, think of 2 moderate intensity flashlights, is now hundreds coming at you from many angles, to where the path of light is now much dimmer, where it focuses, where they overlap, much brighter. That's how it kind of focuses energy. But that's called external beam radiation. And there are different forms. Think of high energy X-rays, we call them photons or protons or carbon. There's internal procedures called brachytherapy, those elements and things I talked about. You can actually do procedures like, these are more operative, kind of semi-surgery, where we put devices either temporarily or permanently into the body to emit radiation.
Technology's come so far nowadays. That's why I'm so glad people like you are here, because that right over my head so much. You're very smart man. But I'm curious, if you don't mind me asking. I mean, like I said, you're a big deal. What brought you here to Rutherford County? Why TriStar?
Many pieces fell together. I have a passion for quality and process improvement. And when I was even before I entered true residency, I started down that path. I was fortunate to have an early introduction to the cancer world. Fortunate and unfortunate, because it's family history is the earliest start of it all. But with that passion of being in clinic, but also doing work in quality and process improvement, I was looking at big groups or big hospital organizations around the country, joined a big multi-specialty group here. As it worked out, I got kind of matched with the TriStar side. and have served a number of roles in the TriStar system before finding my home here at StoneCrest to have my full-time clinic.
Now that's just kind of a perfect fit because it's located. You're part of the Sarah Cancer. What is it? Sarah Cannon?
Sarah Cannon Cancer Institute.
Thank you.
Basically, yeah.
Yeah, right here, and so you fit in perfect with that. So what's the marriage between TriStar and that? So.
Sure. So Sarah Cannon, people, the individual, the former country comedy star, people know her by her name Minnie Pearl as well. Well, she was a patient treated here in Nashville in, I believe, the early 1990s, and donated her name to the organization to use to kind of improve visibility and attract more attention to what they were doing. They were starting up a vast clinical trial network. She really believed in the quality of treatment. And so it became then the Sarah Cannon Cancer Institute, which is kind of like the cancer side of HCA. So TriStar's HCA regional division here, and then Sarah Cannon is their...
Really big deal.
It's the Sarah Cannon is their international cancer organization.
Exactly, big deal.
Yeah.
Right here in Rutherford County. So I just love that. It's, we've been coming here for a long time, doing a lot of updates and everything here, and every time it just blows my mind what you really have here and what you offer. And now big wigs like this guy coming in. He's very modest, folks. But all right, with you being here at TriStar and all that you've seen with all these other hospitals you've been around the world seeing, what sets TriStar apart?
So there are multiple layers here. If you were to ask me kind of picking that destination of where you're gonna settle down for your career, kind of what might you be worried about? And it's, well, joining an area that doesn't have access to a lot of resources, when you may know, hey, my patients need ABC, but I can't get all of those items.
Gotcha.
Well, so thankful that as part of this bigger organization, we have an incredible network of subspecialty physicians. You can get access to pretty much whatever you need subspecialty-wise here. If they don't have it, they recognize it and they get you sent to the appropriate place. From the radiation oncology side, a huge network of both radiation oncologists, and I can tap that bank of knowledge for tough cases, of medical oncologists, again, a huge bank of knowledge, surgical oncologists, and the clinical trials, as we kind of hinted at with the Sarah Cannon Network. I'd say that, and as we'll talk about some on the tour here with this facility, it's a wonderful harmony for radiation oncology specifically of what you need, an easy access facility with high quality of equipment and expertise end to end in the department.
Gotcha. Okay. Now, I know you have a lot to do in this hospital, so thank you for donating your time, but I have one more question for you. So for like myself, I'm a little naive with a lot of this stuff. At what point do you come in the treatment? Like how does that process go and where do you come in?
Yeah, in the modern era, we are very downstream. So you have your initial time, let's say in the journey of a patient who's diagnosed with a cancer, they present to a provider or some clinic with concerns over an issue usually, or during some follow-up appointment, routine health check, or routine health image, like a screening image, to discover an issue. They're referred for diagnosis, whether it's through more images, a biopsy, say tissue is the issue. You gotta get a sample to know what kind of cancer it is.
Got it.
All right, so you go for the diagnosis, and then many times in this network, it's then a discussion from multiple kinds of doctors over, here's the case, what's going on, what do we need to do? Who all needs to be involved? We call those multidisciplinary, like multiple specialty tumor boards. Then patients referred to me after they've identified either like the kind of cancer that we generally involved in, and they let me guide, do we treat or not? Or if they for sure realize there's an indication to do radiation, they'll send to me. So I'm quite, further down.
Okay, well that makes sense. And I, again, like I said, I appreciate your time. We know you're very busy, so thank you for agreeing to come out and do this for us and meet everybody. So again, this is Dr. Ryan Jones. And so I guess people can't just walk in and say hi, right? No.
Oh, yeah, you could. You just can't come back into the
No,
patient.
yeah, I mean like a general doctor where they walk in and get treated. Yeah, but again, right here at TriStar StoneCrest Medical Center in Rutherford County, located specifically in Smyrna, the bigwig, Dr. Ryan Jones. So again, thank you for your time. I appreciate it.
Sure. Pleasure.
And thank you all for watching. Stay tuned. We got a part 2 coming where we're going to show off some of their big fancy equipment that he uses to treat all the patients. So again, thank you for your time. Thank you all for watching.
Thank you.
We'll see you on the next one.